Welcome, everyone. We are going to get started in a moment. We're just letting people file into the room, and then we'll go ahead and get started. Okay, I'm still seeing just a few people in the that are coming into the room. So I'm just going to give it a few more seconds. So then we can pass it on to our excellent speakers. Okay, so I think we are good to go. So welcome, everyone. Thank you so much for joining us today. So this is the second part of our series, Finding a Way Forward, Retaining and Recruiting MAs and DAs in the Changing Workforce Landscape. Today, we're going to be focused specifically on dental assistants. So on Tuesday, we had talked about medical assistants, and now we will be discussing dental assistants. And in a moment, I am going to pass it over to our wonderful faculty and guest speakers that we have today. So just a few housekeeping items and to let you know who we are. So I'm Michelle Fernandez-Gavidon. I'm the Associate Director of Workforce Development here at the Association of Clinicians for the Underserved. So just give you a little sense of who we are. We're focused on access to care and that clinical support for primary care providers. We look at all of this from a policy practice and workforce lens, and we focus across the entire care team. And one of the programs that we work with is the STAR Centers. That's where we're coming to you today. We're bringing you this webinar through the STAR Center. We're one of 21 national training and technical assistance partners. All of our resources are free, and you can contact us at this website. You can go to the website and find all of our resources, and you can contact us at this email, which actually goes to me. But please definitely go on our website, check out our resources. We will also archive this webinar, the recording, and post it on there, but we will be sending the recording to everyone after the webinar is over, including the PowerPoint slides. So although right now you won't be able to download them, you will be able to get them after the webinar. So please use the chat box to ask any questions, share any comments or thoughts. We have Mariah Blake on the call today. She is our program manager. If you're having any technical difficulties, please go ahead and message her, and we will pull up an evaluation at the end of today's presentation. We would greatly appreciate it if you could please fill it out for us. So I want to present today's presenters. We have Candace Owen and Dr. Ethan Kearns. Candace Owen is the Education Director at the National Network for Oral Health Access. She's a registered dental hygienist. Sorry, I wanted to be able to read it so I didn't get anything wrong. And she oversees many of NOAA's educational activities, including NOAA's HRSA NTAP. So NOAA is one of the fellow 21 NTAPs that we have, and she provides training and technical assistance to community health centers on increasing access to oral health care and the operations of community health center dental programs. And then we also have Dr. Ethan Kearns. He's Chief Dental Officer at Salud Family Health Centers. He oversees 10 dental clinics across Northeast Colorado. And in this role, he is responsible for the leadership of the state's largest federally qualified health center dental department. He also oversees the credentialing and privileging process for Salud's 400 clinical staff members as he supervises all care management services for the Salud Family Health. So we're super excited to have both of them here today. I see that we have something in the chat. Oh, that was just Mariah saying hi to everyone. As I said, any technical difficulties, she's your go-to person. So I am going to stop sharing now and go ahead and pass it over to Candace.
Great, thank you so much. I'm going to share my slides here. Great. Well, a special shout out to Michelle at the STAR Center for reaching out to NOAA for today's webinar. And we really appreciate the STAR Center's continued partnership with us over the last few years as HRSA and TAP colleagues. As stated before, my name is Candace Owen. I am with the National Network for Oral Health Access, or NOHA, and we are a membership organization founded in 1991 by a group of FQHC dental directors. And these group of dental directors identified a need for some leadership, networking, and support. So they created NOHA, and I have now over 5,000 dentists, dental hygienists, assistants, partners, and other providers throughout the health center as part of our membership. And pictured here is Dr. John McFarland. He is the founder of NOHA, and he also was the chief dental officer prior to Dr. Kearns at Salud Family Health Centers. So all coming full circle here. And you can tell in this picture, this was a long time ago because there's no PPE, no mask, no gloves, and then also a pretty retro hairstyle there. So a little bit about NOHA before we get started. As mentioned earlier, we are a HRSA National Training and Technical Assistance Partner. So we receive some grant funding from HRSA to provide training and technical assistance on oral health access. So we have a lot of resources that we offer for free at no cost for all health center dental programs, learning collaboratives. We have an annual conference that includes some really great operation sessions, webinars throughout the year. We have a NOHA listserv, which is exclusive to our membership, and it's a great resource to ask questions of your peers. We also have NOLI, which is our Oral Health Leadership Institute, and it is a way for dental directors to gain some training if they're new into their position, as well as a lot of great publications and resources that you can find at our website. If you have any questions after today's webinar, feel free to reach out to info@NNOHA.org. We're happy to connect with you and talk with you through any questions you might have. So Michelle reached out to NOHA because we know that over the last few months, or I guess a couple of years with COVID, dental assistants have really been a sore spot for a lot of health center dental programs. The shortage of dental assistants, difficulty recruiting and retaining them in health center dental programs. And so what we're going to do today is talk about some strategies to engage with your dental assistants to help motivate them to stay at your organization. And what I'm going to do is talk about some results from NOHA's 2021 workforce survey, talking a little bit about salary and job satisfaction and strategies to help with that recruitment and retention piece for dental assistants. And then I'll pass it over to Dr. Ethan Kearns, who will talk about his work at his organization to help promote that recruitment and retention for their dental assistant staff. So let's move into the workforce survey. So every 3 to 5 years, NOHA conducts a workforce survey for job satisfaction and salaries of community health center dental team members. This year was our first year that we included dental assistants. And so we have a lot of great data that is going to be released the next month or so. So this is the first time that we're actually sharing these results publicly, which is really exciting. And hopefully it's good information that you can take back to your organization. A little bit of background about the survey. As I mentioned, it measures job satisfaction and salary trends in community health center dental programs. And we started doing this back in 2008 and have done it every 3 to 5 years since then, with the most recent being last year in 2021. As mentioned, it's our first year to include dental assistants as respondents. What we did is we did 4 separate survey links or surveys for the different team member types. One for dental leadership, which includes folks like chief dental officers, dental directors, dental clinic managers, and then we did staff dentists, so dentists in a non-leadership position in their health center, dental hygienists in non-leadership positions, and dental assistants in non-leadership positions. There are 4 different surveys that essentially had the same questions, just in different formats based on the team member type. We had 647 individuals respond to the survey, and I have the breakdown here about how many people from each team member type responded. The most was from dental leadership, followed by dental assistants, then staff dentists and staff dental hygienists. So before I go into the actual results from the survey, I want to talk a little bit about some of the data that we have when it comes to community health center dental programs, especially in the light of COVID-19. So in 2020, so this is all UDS data from HRSA's UDS. And in 2020, we had 1,375 health center grantees. And you can see that that number actually decreased from 2019, and likely due because of COVID-19. So in 2019, there was 1,385 health center program grantees, and also the patient served reduced since 2019. So 10 less health center grantees compared to 2019, and then 1.2 million less patients served in 2020. This is also from the UDS data, and you can see it shows the number of dental program FTEs from 2016 to 2020. So this is the data that reflects back from HRSA UDS from 2016 up to 2020, which is the most current UDS data that we have. Orange are dentists, red or yellow is dental hygienists, and then green is what they categorize as other dental personnel, which includes like dental technicians and dental assistants. What we're looking really is from 2019 to 2020, there's been a decrease in all these types of team members in dental programs and FTE, likely because of COVID-19, we've been seeing a lot of workforce issues, people leaving the workforce or looking to reduce time and whatnot. So you can see that there was a significant decrease, especially with dental assistants or that grouping in the green, and slight decreases there for all the others, dentists and dental hygienists. Across all the team member types, we've seen that the biggest impact experienced from COVID-19 is the loss of dental assistants. And this is just from information we've received from health centers that we provide TA to over the last year or so. And while we have found that dental assistants say that their greatest challenge while working during COVID-19 is burnout from staffing shortages. So whether losing their peers and then having to pick up additional work and whatnot. So we're really seeing that dental assistants are a significant issue when it comes to community health center dental programs and probably beyond that. And the importance of coming up with strategies to help really try and recruit team members that want to stay in the health center environment, but that will stay there for long term and really help the organization. So looking at our workforce survey that we did, this graph just shows the responses by HRSA region. And so if you don't know what region you're in, you can look it up, and I have a graph later, but you can see that most of our responses came from region 5 and just kind of spread out after that. And this just gives you an idea of how the data reflects when it comes to your area. So we asked the dental assistants to tell us what they were doing before they became a dental assistant. And so 29% of them said that they were working in a private practice before going over to the community health center. 27% said that they were a dental assistant student and then went immediately into the community health center field. And then 26% that said that they were in the non-dental field. Only 15% of dental assistants said that they actually rotated through a community health center before working in one. So actually a smaller number than we anticipated. As we know with dentists and dental hygienists, a really big recruitment point is often having them rotate through the health center. And so it was interesting to see that many dental assistants don't have that same experience. Nearly 50% of dental assistants said that their primary reason for wanting to work in a community health center was that they wished to practice in a community-based setting. And 43% of dental assistants said that they wanted to work in a health center because they felt a mission to the dentally underserved. And this is something that reflects in all of the team members that complete the survey, and that the mission-minded folks are more likely to work in the community health center. And that's really what drives them into working in a community health center, is that they share the same mission, that they want to work in a public health setting, and they have a mission towards the dentally underserved. So thinking about recruitment and retention and thinking about how we can get people to stay at the organization or what type of people we're looking for, it's often the folks that really have a mission that you share as a community health center. So our survey went into some depth as far as their fringe benefits, salary trends and whatnot. So this is information about fringe benefits for dental assistants and community health centers. So we have in this table the number of vacation days, the number of sick days, and the community continuing education reimbursement. So these are the mean and the median from the survey. So about 14 days on average of vacation days, 8 days on average of sick days, and then $116 per year for continuing education reimbursement. And so what that means is, giving funds to attend conferences or take courses, or this also may include their reimbursement for their certification if they have to get one by their state. One thing that we found is that dental assistants receive far less in continuing education reimbursement compared to dental hygienists and dentists. They get over $1,000 less per year. So we're seeing that dental hygienists and dentists have a much larger package when it comes to their continuing education reimbursement. And that is likely because some states don't require or have specific dental assistant continuing education requirements, or they may not have like some type of licensure actually in their state. And so it's something to consider because a well-educated dental assistant is a better dental assistant. And so although your state may not require continuing education or have anything like that for their dental assistants, it is important to consider what you want to gain out of your dental assistant. And so having them attend conferences, whether that is their local dental assistant association meeting or going to your dental association meeting, to NNOHA conference, something like that, there is benefit there because they can expand their knowledge and bring that back into their health center practice. Over 58% of the dental assistants that completed our survey said that the number of vacation and sick days they felt was inadequate. And so again, something to consider when it comes to recruitment and retention, that benefits do play a part in that and being able to have that job satisfaction. And so having conversations with your team members to see how they feel about their benefit package, if it's something that you need to make a little bit more robust. This graph here shows the current dental assistant salary trends. We had 166 people respond to this specific question. And you can see that it really is in the more than likely in that realm of $30,000 to $40,000 a year is what we're seeing as far as dental assistant salaries go. The mean hourly wage is $19.46. And again, this is from them inputting what their hourly rate is. And then we pulled the average to see what the average rate was. And so I'm just giving you an idea. We also have the salary outlined by HRSA region, which is maybe more meaningful for many of you because we know that cost of living and whatnot is really different across location. And it can even vary within your state. For example, I'm here in Colorado. The cost of living in Denver is significantly different than say where I'm from, Alamosa County. And so I'm looking at that as well and making sure that you're competitive for your area is really important. It's important to look at this table that's on the bottom of the graph that is showing the number of responses by HRSA region. And so take this information for a grain of salt because your region may have had only 2 to 5 respondents. So that's not a really accurate depiction of what the salary is for that region. It's just something for you to consider. We saw that, again, the majority of folks responded that their salary is between $30,000 to $40,000 a year, and with very few going up into that beyond $50,000 a year. The map there is the HRSA region. So if you wanted to save the slide, you're able to kind of compare and look what region you're in and then look at the salary trends. So now comparing dental assistant salaries, according to our NNOHA survey, this 2021 survey, the median hourly wage is $18 an hour. And according to Danby, the Dental Assistant National Board, they completed a similar survey from 2020 to 2021, so the year before, and their median hourly wage was $19.80. So nearly $2 higher reported by Danby. And the important thing to consider with Danby is that they include a variety of dental assistants. So the NNOHA survey is exclusively community health center dental assistants, whereas Danby includes folks who are working in the private sector, like private practice clinics and whatnot. And so I think that is a struggle that we hear a lot from health centers, is that they can't compete with the private practices because they're offering more. And that data is reflected here. But in order to be competitive and to retain and even recruit dental assistants, the salary needs to be up to par with the private practices. What you invest is what you get back. And so looking at your salary and seeing what you're able to provide in comparison to the private practices or clinics around you is especially important. And so I think this is really telling that community health centers, based on this data alone, are paying less than the general practices do. So job satisfaction is something that we look at our survey. Dental clinic staff and support is something that is really a driving factor when it comes to job satisfaction. 58.5% of respondents said that the number of dental assistants in their community health center is inadequate. So again, reflecting the shortage that we're seeing, that they do not have enough dental assistants to support the patient load that they have. Nearly 63% of the respondents said that the quality and experience of the dental assistants that they have is adequate. So that is great that the majority of the people that responded to the survey are saying that their dental assistants have that skills and expertise. It's just the matter of finding them, of course. NNOHA recommends a dental assistant to dentist ratio of 2 to 1. So 2 dental assistants to 1 dentist. And this is not including having an expanded function dental assistant. So if you have an expanded function, then that's a little different, the ratio recommendations. But what we're looking at here is 2 to 1 for just a dental assistant or registered dental assistant to a dentist. And 56% of the people who completed our survey said that their ratio is inadequate, meaning that they don't meet this 2 to 1 ratio. About 54% said that their average ratio is between 1 to 2 dentists to 1 to 2 dental assistants to 1 dentist. And so again, showing that there is a shortage, or folks are really experiencing challenges in having dental assistants in their clinic because they're not meeting this recommended ratio of 2 to 1. Only 8% have 2 or more dental assistants to 1 dentist. We asked the folks to tell us their intention to stay at their community health center. What is your timeline? How long do you plan to stay at your community health center? And so as you can see, it's a little spread, but then 35% say that they plan to stay at their health center for more than 7 years, which is great, meaning that perhaps health centers are doing something right as far as retaining their dental assistants, and maybe the challenge is more recruiting them. And so looking here, that there is a pretty decent amount of folks who plan to leave in less than a year. That's 14%. And then right in the middle there, for 1 to 5 years, about 20%. We asked those who said that they plan to leave in 5 years or less, what were the reasons? And about 57% of the dental assistants who plan to leave in 5 years say that they need to increase their income. And so again, reflecting the importance that salary is a driver for folks to stay at their organization. And nearly 25% of them said that they plan to leave because of burnout. This was the second highest, but this is not COVID-19 related burnout. And so there may be other reasons. And so the importance of dental team wellness in the organization as well, and putting that on the forefront. Some recommendations that we have based on these results and some of the strategies that we've learned over time. Mission-minded individuals are more likely to want to work in a community health center. It may be difficult to find these folks, but that is especially important, is finding people who share the same mission as your organization. They're more likely to stay and more likely to be hired. Increased salaries and benefits could help with recruitment and retention. I know that's often a challenge to compete with the other clinics in your area, but getting as close as possible. We recommend creating competitive salaries and maybe looking at the benefit package, looking at the amount of CE benefits that dental assistants are given is significantly lower than dental hygienists and dentists, which is understandable. However, there are reasons to try and increase this at benefit of your organization as well, not just for the dental assistant. And creating a greater investment in your dental assistants will likely increase retention. Some things to think about are monetizing your benefit package, which we've seen with a lot of organizations, finding a way to calculate how much does the benefit package cost, which could help influence someone's decision. If you're not able to provide a salary that is higher, that showing the actual cost or the value of the benefit package is a great way to try and recruit individuals. So before we hop over to Dr. Kearns, I'd like to go through the chat just really quickly. Or do we want to wait until the end?
And Candace, I am happy to read the questions that are in there. I was going to ask you the same thing because a lot of the questions, or pretty much all the questions, are very specific to the survey that you did. So if you want, I can read through them, you can answer, and then we'll pass it on to Dr. Kearns.
Yeah, sure. I mean, I do have the chat up here. Okay. I have the chat box, so I can do that really quickly, unless you have a Q&A on your end. How do you know if your FQHC participated? It was anonymous, so I guess there's not really a way without asking your team members if they completed it. And we'll have a full report of all of this information that's far more detailed than what I presented here that will be released later this month. The hourly wage is calculated on the 166 people that responded. That is correct. As far as hourly wage in consideration of years experience, we'll have that broken down in our salary survey report. The survey does include registered dental assistants, not just dental assistants. It includes both, and it's really difficult to break that down because every state is so different. Some states don't have registered dental assistants, some do, and so we just include, are you a dental assistant? We do have information broken down by expanded function dental assistant as well that will be included in the survey. And yeah, I mean, it's definitely true. A lot of FQHCs may not have control over the benefits, especially in union environments, but definitely important about taking time every now and then to look at the package. What are you offering? What are some things that you can improve? And is there anything that you can do to be a little bit more competitive to help with recruitment and retention? And again, asking about the year's experience, we do have it. The problem is that as similar to like by HRSA region, a lot of times it's not really reflective because you may have had only like 2 to 3 people who say that they have like a specific number of years of experience. So it's important to really look at your environments, talking to other clinics that have FQHCs in your state, in your area, talking to your primary care association, because they may have better data that really is more robust than having like 2 to 3 people to say that their salary is this after this many years of experience, if that makes sense. So my email is here, candace@noah.org on the left. Feel free to email me directly if you have any questions about this information, and we're happy to talk through anything with you. And as I said, we'll have the full report of our salaries and whatnot that's released later this month. And I'm happy to share that with Michelle so she can distribute to the folks who are on this webinar. So I'm going to stop sharing my screen and I'll pass it over to Dr. Kearns.
Great, thank you, Candace. Let me go ahead and share my screen here. All right, so hopefully you all can see my screen. So as was already mentioned, I am...
sorry, oh. Dr. Kearns, I don't think they can share, we can see your screen yet. I don't know if it is just me, but I'm not able to see it.
Moment, please.
Absolutely. And totally understandable. We're all in this Zoom world. So there are always little tech glitches. Oh, yep, now we can see it.
You see my screen now?
Yes, that's perfect. Thank you so much.
All right, no, I appreciate it. Sometimes I need help with the technology. Hello, everybody. I'm Dr. Ethan Kearns. As was mentioned earlier, I'm the Chief Dental Officer at Salud Family Health Centers. We're a health center in northeastern Colorado. We're a larger health center. We have 10 dental clinics. And then I'm also the current president for NNOHA, the organization that Candace is from as well. So I'm super excited to be here today. I'm here to talk to you about just one of the ways to train a dental workforce. So I find this is an issue at a lot of health centers, and we were struggling with it years ago. So we decided to develop a training program that would allow us to really hire anybody without experience, train them, give them the skills they need to be successful as a dental assistant. So we call this our career ladder program. So what are our career ladders? It's really our development program for our frontline staff. And I'll get more into this throughout the presentation, but we developed 8 different career ladders. And 2 of those are for dental team members. And when we built this, it was designed to be a comprehensive curriculum, and it's really just to increase the knowledge and skills of our staff so that we're setting them up to succeed in their roles. This was a huge commitment for us to invest in our staff. It was quite a bit of work to build these career ladders for the different branches of frontline staff, and I'll go into that through the conversation, but I feel like this was a wise investment, and I feel like it really has paid off a few years later now since we've implemented it. And really the goal is to develop a confident and qualified frontline staff, which can better serve patients and our providers. So I do want to be clear that the overall education of our health center is for everybody. So everyone at our health center has to take HIPAA training, or bloodborne pathogens, right? There are trainings that everybody needs to take. The career ladders is just a piece of our education department. The career ladders is designed only for the frontline staff positions. For example, it's not designed for providers. It's really just to increase the knowledge and skills of our frontline staff. So why do we feel this is important? Why did we invest all the work and time into making these? And really, number one, we heard from our staff that they really wanted to increase their knowledge and their training to be successful in their roles. So we were hearing it from our own staff. Another reason is that research has shown when people are trained to perform at the top of their scope of practice, they enjoy being at work more. They provide a superior service to our patients, and as a result, our patients are more satisfied with their care at our health center. And so we built these career ladders with 2 goals in mind. Number one is that we can train new people who don't have very minimal skills and knowledge, and we can train them all the way up to being a very knowledgeable, successful frontline staff member. But we also wanted to refresh the knowledge of our current staff as well, who may have been with us for a number of years. So let's start talking about some of the courses, and then I'll show you what our ladder looks like. We made multiple courses per level in our ladder. And what we found was that people learn different ways. And we really wanted to take that into account when we developed these courses. So our courses they'll contain some reading material. Many of them will have movies, multimedia segments. Some of them are interactive, and we have evaluative measures. And so we did try to take into account different styles for learning. And again, the content that we created for these 8 different ladders that we built is really with the goal to improve their skills and knowledge. And then we'll get into this, but some of them is building them up to pass a certification exam. So how are the courses completed by the frontline staff? We want all of the work to be done during business hours. So the supervisor would identify time when staff members could work on it. So typically there might only be 1 staff member working on ladders during the day, but the other staff members are needed on the floor. And so staff, they'll ask their supervisor, can I work on this? In the next few days, I'm ready to take this next course and pass it. All of the coursework is taken in our learning management system. So it's all online. We use computers at work, and it's all within our Salud system. Each course takes generally 30 to 40 minutes, depending on the topic. And after they pass the exam, after they are done with the course, they must pass a quiz at the end of that course. And they have to get an 80%. Otherwise, they have to retake the quiz. And when we made these quizzes in the final exam per level, we made a bank of questions. So if they have to retake a quiz or final exam, the questions will be different. And that was our goal, that they just can't keep retaking it to pass it. When we did build these 8 ladders, we did designate a lead to oversee the development in each of their ladders. So for example, the 8 ladders that we built one for contact center agents, one for customer service associates, it's like our front desk. We have one for dental assistants, one for dental clinic coordinators, that's our dental front desk. We built a ladder for enrollment specialists, medical records, medical support staff, and pharmacy technicians. So we had to have a lead in each of these different disciplines that was in charge of the content for their ladder. So for the dental assistant ladder, I was the lead, and I determined what content do our staff need to practice at the top of their scope and be successful in their roles. So also for the dental, how did I determine what they needed to know? We'll go into that a little bit further in the presentation, but we made the decision that we wanted all of our dental assistants to pass a certification exam. And so we looked at what is the knowledge required to pass this exam, and that's what I determined what to put into our ladders. So here is a screenshot of our dental assistant ladder. And I know that there's a lot of writing on here. It might be a little bit small, but you can see on the left side is orientation. That's the first level. And then once they are done with orientation, they would move up to the second level, which is the apprentice. And then the third level, which is level 1. And so each of these levels, there is a time requirement when they must complete it by. So orientation, for example, must be completed after their first 90 days at work. We put content into this level that we felt was necessary just for them to start in the role as a dental assistant. And so it's got very basic things. You can see like the dental electronic health record, introduction to dental radiology, and dental chairside procedures part 1, dental instruments and equipment part 1. And you can see these are part 1s, which we build on in higher levels of the ladder. So the second level, the apprentice, this must be completed by the end of their first year working at Salud. And then you can see the courses, they require a little bit more knowledge. And then you have dental chairside procedures part 2. So it's building on the knowledge that they learned in orientation. Also, when we built this and I determined what should go in the dental assistant ladder, again, we looked at what's needed to pass the certification exam, but I also went to my dental staff and said, what do you need to know? What would you like to know more about? We have about 60 dental assistants at my health center. And it was unanimous that they came back and they said, we want to better understand dental terminology. We feel like the students and the residents we host, they're using words, we don't know what they mean. We want to understand better what they're saying. So what we put in, basic dental terminology. It's not necessarily on the certification exam, but my staff requested it. So we put it in. And then you can see level 1, it has advanced dental terminology. So the way it works, orientation must be completed after 90 days. Apprentice must be completed after 1 year. Level 1 must be completed by the end of year 2. And this is a requirement to remain a dental assistant at our health center. Anything higher, levels 2, 3, and 4, is optional. And we'll go into that a little bit more in this presentation. Here is the dental ladder for the dental clinic coordinator. So this is essentially our dental front desk. And so this is a hybrid. It takes some of the courses from our dental assistant ladder, but it also takes some of the courses from our customer service associates, which is the front desk for medical behavioral health. And so there's some overlap between the ladders. And again, all 8 ladders follow the same framework. You've got an orientation, an apprentice, and a level 1 that are required, must be completed within the time frame. Levels 2, 3, and 4 are optional. So that's the framework. So how did we put this all together? How do we create the content? Really, we read through a lot of textbooks and we talked to a lot of the dental schools where we host students from. So we take dental students from 4 different dental schools, and we participate with a residency. And so we spoke with them about what should be in this. We made many videos here at Salud, and it can be small things: how to make an impression appropriately, how to work our nitrous, what's the proper settings for it, how to properly answer the phone, how to properly bring the patient back to the chair and ask the health history questions. So very specific videos that were our own staff, really in our own operatories. We did purchase a lot of photos from third-party vendors. We were very, very cautious to not worry or to not violate copyright laws. We do have a lawyer on our staff, so he was heavily involved to make sure we are not infringing on copyright anyway. As I mentioned, we had leads that took care of the content in the ladders, but then we also identified some champions who were really passionate about improving the knowledge and skills of our staff. So I identified some dental assisting champions, and they would talk about it with the other staff. And we did solicit feedback throughout the process. Again, I asked my staff, what do you want to know more about? I did try to engage them, and we really tried to make them understand this is an investment in them. We're trying to help them be more knowledgeable, more successful in their role. For every course that we made, we did make learning objectives, and then we have them take the course. And then again, at the end, they take an exam that they had to pass in order to complete that course. So this is just an example of some of the course objectives that we had. Here's just a screenshot of what one of the videos looks like that we use in our system. This is on the medical assisting ladder. And this is just a screenshot of an example of a quiz question at the end. It can be multiple choice, it can be match, it can be fill in the blank, it can be true, false. Again, we try to use different styles of the quiz questions and how we presented the information, just because people differ in how they take tests and how they learn. And then at the very end, they get a certificate. So they're emailed this certificate saying, all right, you passed the course. Some of them they can actually get some credit for. And that way they know that they have completed the course. And that way their supervisor knows that they have completed the course. So how do you advance from one level in the ladder to the next? So let's say you just completed the orientation, you're at the end of your 90 days. How do you move up to the apprentice level? So you must complete all the courses that were listed there, which means you've read all the content, you've passed all the exams of 80% or better. Then you must pass a final exam for the orientation level. And that's 100 questions for the exam, and they must get 80% or better. And that final exam will ask questions from all the courses combined. And again, if they don't pass it, we have a much larger bank of questions. If they have to retake it, it'll be different questions. So they must pass the final exam for that level. On their most recent employee evaluation, they must have a meets expectations or exceeds expectations. If they have any other standard, like expectations not met, they cannot move up. And they also cannot have any written disciplinary notices in the last 6 months. Otherwise, they cannot move up as well. When they do move up a ladder level, then we did color code it. So our levels have a specific color. And here you can see when they move up a level, they get a new lanyard to hold their badge. And so these are the colors that we used so that you can see anybody on the floor. You can tell right away where they are in their ladder's progress in the training process. And so when they are approved to move up a level, they are mailed their new lanyard. We spoke about this a little bit already with the new hires. There are deadlines. Let's say that the frontline staff member is not hitting their deadline. If they have now been with us for 90 days and they have not yet passed the orientation level, then their supervisor is notified and they are giving 30 more days to complete it. Otherwise, they are dismissed from their role. So they will be given up to 120 days to pass it. Otherwise, they are given their notice and they can no longer be a dental assistant with us. The certification exam, this is a decision that we made. In Colorado, we do not have to have certified dental assistants. And there's different exams out there. Candace mentioned DANB as another very popular one as well. But we determined that on the medical side, we are required to have certified medical assistants. And I wanted to hold our dental assistants to the same standard. And I wanted us to show that our training program was strong enough that they could pass this. And so we made the decision that we're going to require all dental assistants to pass the American Medical Technology Certification exam. We were already using AMT for our medical assisting tests. And so we just added on the dental. And they provided an outline of what is covered on their exam. And that's what I used to determine what to build in my first 3 levels of the ladders. Because they have to gain all the knowledge necessary through orientation level 1, level 2, so that they can pass this AMT exam, right? This is a national exam, it's not our exam. So this is showing that they have gained enough knowledge to pass a national certification exam. And they must do this, otherwise they can no longer stay a dental assistant at Salud. And so we made this an expectation. After they have completed level 1, then they must pass AMT, and that must be passed at the end of their 3rd year with us. And really, this is just a commitment to show that we want our dental assistants to be as highly trained as possible so that they can provide the best possible service to our patients, but also it empowers them in their roles as well to perform the best they can. For the American Medical Technologies exam, if they fail the exam, then we give them 60 days to retake. If they fail it 3 times, then we do give them notice they cannot stay a dental assistant. And again, this is optional. We just wanted to hold them to the standard because we felt like it was important that we can demonstrate our staff are being highly trained. Let's say somebody didn't pass the AMT on the dental side. They're still eligible to be an employee at Salud. They just might be more successful in a different department at Salud. So then we would start looking for other positions that might be open that they could transfer to. So I've spoken a lot about the first 3 levels of the ladders, which is the orientation, the apprentice, the level 1. And then here I'm showing the second half of the ladders, the level 2, level 3, level 4. And this is the same, exactly the same for all 8 ladders. And our vision for this was for those members who want to go above and beyond and might want a leadership role, or they want to become a lead, or they want to move up to a management role. We wanted to offer them the knowledge and skills, a path that they could move into that role. So you can see this covers things that isn't specific to, say, a dental assistant. It's things like employment law, communication, how to lead a team, recruiting and selection. And so how do you coach people? These are all skills that we want our management to have in the future. So we're trying to make a pipeline for our future leads and management. And again, it's optional. And we've had quite a few staff members attend these classes and they're moving up. And then the final level, level 4, currently still under construction. We hope to have it done this year. COVID put a delay on it, but it's a capstone project. We want each member to look at their clinic, look at Salud as a whole, what's something they feel like maybe we could improve, run a capstone project for it, and then report back to the committee what they learned. Do they have recommendations how we can improve? So this is really them taking the own initiative. This is voluntary. So these are just some statistics about the advanced ladder levels. Currently we have 135 employees in level 2, which means that they have gone past the required level 1. So they are choosing to continue up the progression. And again, it would make them eligible to become leads in their role. As far as compensation goes, we do offer a small raise once they complete level 1 and pass their certification exam. And then at the very end of the ladders, they get a pretty significant bump in salary after the capstone project. My CEO did have us put in the bottom of the slide a little asterisk based on budget considerations. But the idea is that they do get some compensation, because as they become more highly trained and provide better service for our providers and our patients, we also end up to compensate them more because they're providing a higher level of service. So tips for building a ladders program, for us, really, you have to identify what do you need your staff to know to be successful in their roles. And I've already gone through how we decided that here at Salud. You do need to identify who's your subject matter expert, who's going to be the lead of that ladder that determines what courses need to be built. And champions are important. When we launched this, there was some hesitation among our staff, especially when we said you must pass it or you cannot stay in your role. A lot of people are nervous. You know, at this point on the dental side specifically, I've had over 30 assistants pass the AMT exam. Not a single one has failed. Every single one of them has now passed, which means our training program is setting them up to succeed. We haven't had to let anybody go because of this process. We did hire an instructional designer, somebody who was, a teacher, and they helped us design the content to make sure it was presented well and meaningful. And then this took us a long time. It took us about 5 years to build this. It took a lot longer than we thought. So please do not underestimate the amount of time and work it takes to build these curriculums and to put it together for your staff. All right. And that's the end of my slides, but again, happy to answer any questions from the group.
Oh, I was on mute. So we do have a few questions in the chat. So I'm happy to review the questions, or if you want to look on the chat to address them, whatever you prefer.
So let's see here. Cannot see the screen yet. Okay. All right. I think this one might be from
sorry.
Maybe the first one for me is from Stephanie, I believe. Is Salud's learning management system proprietary, or did you build it out using a standard LMS? So we used a standard LMS, and actually we went through a few different versions. We started with Canvas, and then we used Bridge, and then now we use, it's called Scoops, and it's connected to our UltiPro system, which we use for accounting. So it's just standard LMS that you can go out and purchase. And again, we've switched it a few times throughout the process. So next comment, this is incredible. So your recruitment was only internal throughout your health system. Was there a retention expectation included? So we did not include a retention. I've been asked commonly, did this reduce your turnover rate, for example? And unfortunately, I don't have that data. Anecdotally, I can tell you, before we started this, it was really hard to find dental assistants because, like many health centers, we really strongly preferred somebody to have a certificate. They'd gone through an educational program that taught them how to be a dental assistant. And after we were done with this, I truly believe we can take anybody and we can train them to be a solid dental assistant. So my pool of applicants really grew. So I can tell you now, from before we did the ladders, it's much easier to recruit dental assistants. And in my health center, some of my clinics are urban, but some are very rural, right? So in both environments, I feel like it has improved because there's more applicants we can now accept. Is there a mentorship component? Not necessarily. Every clinic does have a lead, which can help their dental assistants through the process. And again, as I mentioned, the higher levels, the higher part of the ladder, which is the same at all 8, if they want the leadership training, that's how they get themselves on track to become a lead. Part of that is coaching and training the other staff. What is the pass rate for level 1? Do you have much attrition or transition out of the DA role? So again, we have not had to let a single person go. There have been a few people I've had to remind, like, your deadline's approaching. I need you to focus on this. But we have not had a single person not pass the AMT exam. Of the 30 that have now passed it, I think 1 had to retake it once. Otherwise, they have all passed it, which means our training is preparing them to pass that exam. So we have not had any attrition. And again, initially, my staff were scared. They thought we're trying to find a way to let them go, which is clearly not, the result. Now they're highly trained, they're certified. We pay for the certification and they got a raise. So now they're pretty happy with that. Do you find that there are some folks who are staying in certain level and not moving up the ladder? How do you manage this? So if it's on a required level that they must move up, like orientation or apprentice or level 1, then I get emails as the lead saying, look, these people are not moving up. They're approaching the deadline. And then I will communicate with this person and their dental director at my clinic to make sure to get them back on track. Because part of it is the supervisor needs to identify time for them to work on it. So it's, if the dental assistant isn't making time, then I need to be on the supervisor saying, I need you to find time for this dental assistant to do the courses during work hours. We didn't want people to be doing this after work. We didn't want overtime. You know, we were worried about people trying to do it at home and may not have reliable internet. So we just standardized, it's all done at work. So that's how we prioritize the time. But otherwise, they don't have to move past level 1. That's optional. Again, not everybody is. So did you build all of your lighters at the same time or prioritize based on needs identified by your staff? We built all 8 at the same time. Now, some ladders took a lot longer. So my medical records ladder is not nearly as robust as medical assistants, dental assistants, for example. So we started together, but some of us took a little bit longer because we have a lot more content, a lot more courses. Is there a test out option, i.e. 80% score on pretest so they can skip that module? Nope. We require everyone to go through the courses. Everyone must pass the exam at the end. And again, well, they have to pass the quiz for each course. And let's say there's 10 courses in the level. Then at the end, they have to pass the exam that has questions from all 10 courses. There's no pre-testing out. We wanted our existing staff to go through the process. And some of them were hesitant in the beginning as well. They thought, I know all this, why do I have to go through this? But even, you know, they found value in it. And that's one of the reasons I put dental terminology in. They're the ones that asked for dental terminology. So I said, great, I'm putting in there what you want. I need you to go through and take it all. But so not much pushback after they went through it, because again, now they're certified and they weren't before, and they didn't have all the knowledge they needed to pass that certification exam. How do you handle the x-ray and coronal polishing training? So part of the training is obviously competency that's hands-on training. So some of the didactic work can be done on a virtual, you know, on a computer, but obviously with dental assisting, some of it has to be done in the clinic. You know, sterilization, infection control, room turnaround, you know, whether it's setup for composite, setup for crown. Part of one of the ladder's courses is have they passed their competency, which must be passed after 90 days. And that's, I have a document of everything that must be demonstrated in person. And they must check it off in the orientation level to pass it and move up to apprentice. So there's a combination of what's didactic online and what is in-person competency at the clinic. And I believe that's all the questions that I see.
Yes, those were all the questions. We do have 2 minutes. Anybody has any final questions, please feel free to just put them in the chat. I just want to say such a huge thank you to both Candace and Dr. Kearns. We are very aware of how important it is to recruit and retain dental assistants. Our first session as well with medical assistants. So here at ACN the Star Center, we're really focusing on that, and working with these partners are absolutely excellent. So thank you both. It was an amazing presentation. Mariah will be pulling up the evaluation in a moment, so we would greatly appreciate if you could please fill that out. It helps us bring you this type of programming. So Candace, Dr. Kearns, is there any last things that you would like to share or say?
Not from me.
Yeah. And if not, that is totally okay. So we are happy to give everyone a minute back in their day. And again, thank you so much for joining us. And we really appreciate your time here. Bye, everybody.